Welcome to another Aligner Insider podcast. Well, hello, everybody in podcast land. Welcome back to another Aligner Insider podcast. I am Dean Steinman, President of Ortho Marketing, and to my right today, I have Dr. Barry Glaser, world-renowned orthodontist, lecturer, writer, and great guy. And we're super stoked today to have on my left Philippe Salah, who is the CEO of Dental Monitoring. And we're real excited to have Philippe join us today. Dental Monitoring is a credible platform program out there, and we'd love to educate the public and the community on what's going on at dental monitoring in the world. So, Barry, Philippe, good day. How is everybody today?
Good morning, Dean. Thank you for inviting me. Good morning, Barry, and always a pleasure to speak to you.
Oh, thank you so much, and good afternoon to you. So, Philippe, let's just jump right into it. So, why don't you tell us who is Philippe Salah and how did you come up with dental monitoring?
Oh, thank you for this question. So who I am? I'm just a French guy with lots of ambition, and especially in the dental world, which is a very open-minded world. I find my way into it. I'm graduated in pretty still young. I'm 40. Graduated in 2007 of a
Right.
PhD in physics. And straight after my PhD, with no link to dental, I met with an orthodontist at that time, and I just fall in love about dental. And from that, I created a first product, a lingual product that has been well received by the market at that time. And it was based on this first success. I created a journey around the patient experience, around how can we solve a problem when the patient is not into the clinic, and this where comes the first idea of dental monitoring. How can you continue to see your patient, to monitor your patient, to provide good care when your patient is not at your office?
Hmm. And it's funny how things come around. Obviously, how long ago was this when you first came up with the dental monitoring program?
Oh, so it was far before all this crazy
Mhm.
COVID thing. I created dental monitoring in late 2013.
Okay.
Yes, with the first generation product. We released a first product in 2000, late 2015, beginning of 2016, which was really dedicated to provide to the doctor access to intraoral pictures taken by the patient through their smartphone. But this was far from being sufficient. We needed to bring even more automation, artificial intelligence, good processes, workflow, and this came later in 2017, 2018.
Okay, doke. Yeah, so it is funny how things obviously come around. Who would have thought that we'd be in a virtual world, 5, 6 years ago when you came up with this there. So let's back up and tell us a little bit about the dental monitoring story. So obviously, so now 2013 comes along and you came up with this idea. How did you get it, from your mind to a piece of paper to actual manufacturing and into people's hands? How did the process work? Tell us the story.
So very early, you have to take the context. I just left American Orthodontics because I sold my previous company to American Orthodontics at that time, and I was pretty well funded to create my next venture, which helped a lot because when you create a company, you need pretty significant money to start something. So straight from the bat, we hired close to 30 people to work
Wow.
on technology at the beginning. Lots of engineers, machine vision, lots of app developers, backend developers, and so on. And with only one goal: create an outside clinic experience to the patient, which brings them back to the clinic only when needed. Bring the patient back to the clinic only when needed. And this first experience came I told you, yes, around 2000, late 2015, 2016. But the experience was pretty crap. The picture was not good. There were no automation, and luckily we were well funded, so we were capable of rebounding, and we created a device to take good pictures. It's where comes the scan box at that time. We have created a complete device who help the patient to actually take pretty good intro pictures, which will be then used by the artificial intelligence and inside the workflow. Because I like to mention one of the doctor working very closely with us, who told me at that time, Philip, garbage in, garbage out. So you need to put good things into your system.
Sure.
So then from this Canbox good experience, we developed also an automation system. We did not went to artificial intelligence because we believe that artificial intelligence is trendy and it brings lots of value to the company. No, we went to artificial intelligence just because it was a necessity, because we can't imagine that a doctor is looking after every single pictures every week on his computer. Doctors don't want to do this, and there is no way you can sell them this type of offers. So we needed to bring something which will triage the information that are going to the doctor, sort them, filter what is crap, what is good, where there is some critical information that needs to be displayed to the doctor. This come what we call the notification center and the usage of artificial intelligence. So then we have invested really big time and money into this artificial intelligence platform to come to what the products stand now today, which is what we call a full virtual practice, with coming from the lead generation, patient acceptance, and now to the patient management during treatment. We believe that we are the only platform providing all these automations and
Right.
quality of care.
So Barry, I'm going to throw it to you. So obviously you get asked many, many times throughout your day for your emails, phone calls from different vendors or platforms trying to sell you products. What stood out about dental monitoring to make you look at it, A, and then B, to implement it? Because I'm says, I get literally dozens of emails every week from different software providers and companies in the industry, and I'm sure you get even more than that. So, what kind of tipped you to say, yeah, this is interesting. I'll give it a shot. And then, what caught your eye in the first place, too?
So I was at the AAO meeting in must have been LA. So that's 2.5 years ago. And was sort of on a mission to learn. I can't remember the topic, but I went to a whole bunch of different lectures, and I went to the last lecture, and I had like an hour to kill. So I walked out of the lecture hall. In the next lecture hall, I see this lecture by Dr. Terry Sulky about automation. I can't remember exactly the title, but it piqued my interest enough that I figured I'd sneak in. When you kind of sneak into the last chair by the door. So after five
Right.
minutes, if you don't like it, you can just duck out. And Terry was talking about. I kind of probably came maybe 10 or 15 minutes into the talk, and he had up this screenshot of this dashboard, and immediately it was. I mean, they had me at hello, Dean, and
Right.
I looked at
Okay.
this and I thought to myself, being someone that has 80% of their patients in aligners, it just instantly made sense to me that I could see this connection between remote treatment monitoring from let's say from my perspective, that maybe would be something that would help to get my patients to be more compliant. That I think was like the first thing that kind of caught my eye. So I listened to the lecture, and at the end of the lecture he mentioned that there was a booth downstairs in the exhibit hall. Went downstairs and I talked to some nice folks. Got to meet Dimitri Tops and can't Philippe. I can't remember if you were there or not, but I think you were busy. I might have got to say hello to you in a minute. But pretty much, I decided to sign up right on the spot, and that's not my typical mo at a meeting. I have this rule against impulse purchases, but
Right.
even the sign up, it was really very low risk. I could, it wasn't like you had to pay a large upfront cost, so you could basically get set up for a relatively small amount. It was under $1,000 to have them come in and train, and then you could do it. You could use dental monitoring on, let's say, a group of patients, maybe 10 or 15 or 20. At least that was my thinking. And I figured I could, for a relatively little investment, for a couple of $1,000s, I could kick the tires, take it for a test drive, and see what I thought. And we haven't turned back since. It's been even much more than what I originally imagined it to be.
That's a great, and obviously a recommendation from Dr. Glaser goes a long way in this community there, and I'm glad that you're able to do that. And I'm going to put my consumer hat on, and as a patient of yours, Barry, I'm using the dental monitoring platform just to keep track and to make sure that my aligners are working, and
Hmm.
it's incredible the fact that I don't have to come to your office. I love you, man, but if I don't have to come to your office and it's telling me that keep turn to the next tray or keep them back on again, it's a no-brainer. So as a busy person, I really appreciate this program here, Philippe, and I think it's great from a consumer standpoint, and obviously from the provider doctor standpoint, it's even better. It's making you more efficient. So now let's talk a little bit about the orthodontic industry. And it's end of 2020 now, and now that we're in the last 7 8 months has been pretty interesting world. So tell me a little bit how dental monitoring has changed the orthodontic industry in the last 6 7 8 months, and you know what kind of feedback have you received from other providers on that there, because in my eyes it's a game changer. So how do you see it from your side over the last 7 8 months?
I think we have tried to be a big support to the dental community and to the orthodontic industry. Just the number speaks by itself. We now monitor more than 500,000 patients, which is just I did not believe when that I would achieve this within just few years, adding so much patient into the platform. So I think what has been the perception of the industry, it's we became we have been before we were a nice to have product in clinics who wants to evolve, who wants to offer better experience to their patients, etc. To now we became a must have product in lots of clinic which need to compete against DTC, who needs to really have a way to see the patient in this environment, which basically seeing patient become difficult and become expensive. So we believe that today the orthodontic industry is accepting this concept of virtual clinic because they are accepting that this is not bad care, but this is now literally the definition of continuous care and even better care.
Hmm. And Barry, let's throw you in there. So, what I mentioned before. So, how has dental monitoring changed you and your practice in the last 7 8 months, as far as implementing it in?
So I was grateful that we already had all the workflows and technology already fully integrated before COVID-19 hit. So for us, it was a godsend. It is it's the tool is so valuable. And but I just want to get back to something before I answer that question, and I still get this from a lot of doctors, and they still sometimes they'll say something like, "Well, you're going to use dental monitoring, you're just as bad as the DTC companies," and I find that ironic because in my mind, and I think the doctors who use this technology, they don't understand what the product does because it's the opposite. It's the opposite of DTC. I'm the doctor. Patients come in. It does not eliminate the need for a proper diagnosis, treatment plan, treatment records, all of the stuff that Dr. Gianelli taught me back in Boston University. So it doesn't change how orthodontic care is diagnosed or treatment plan. It changes obviously how it's delivered. We're using clear aligners mostly in the practice, although you can use DM with braces too. But it's changed the way that we get to encounter with our we get to meet with our patients. So Dean, for example, in your case, I see you every week virtually. Now, I can understand that. Listen, Dean and I are both baby boomers, and maybe for us, you get a new remote control, and it's for your TV, and it's a source of stress. So I can understand how technology that there's maybe this natural aversion, especially for let's say in the baby boomer um, uh, group. for new technology. But I think the key thing here is that I am not a slave to the robots, which is maybe what people are worried about. It's really the opposite. The robots are a slave to me. They're my servant. So I'm able to see your case, your aligners, your teeth, your soft tissues on a weekly basis. It just happens to be on my computer versus sitting in a dental chair. So what does that mean? Well, in a pandemic, it means that we can have fewer patient encounters, less exposure to virus particles. From a pure business standpoint, it allows for, let's say, fewer days worked and a smaller staff and savings in overhead in other areas. I mean, I could go on and on and on. I mean, I don't want to hijack Philip here, but it's really, I mean, the list goes on and on of the benefits.
Great.
Um,
And yeah, Philip,
Barry, you can't add Jack. Give all what you think about the product. It's it's always a pleasure to have a client which is so happy of the product that he speaks about it. It's much better than me speaking about my product. So
sure.
yeah, Dean.
Yep. So let's keep going there. So obviously, as an entrepreneur, developer, renaissance man in this industry, while you were developing dental monitoring, what was the biggest challenge that you faced, and how did you overcome it?
Oh, I think the biggest challenge, and which is still a challenge, it's to convince doctors that we are not replacing doctors. It's a misconception about what does artificial intelligence. Artificial intelligence, you have to accept, is a representation of technology, but it's absolutely not going to replace a doctor, and never. It's not even designed for it. I think this is the biggest challenge, and I now the people start to accept that we can enhance the capacity of doctors. We can give them a third arm or a double pair of eyes. It's better, and it's more contact with the patient and so on. But we are never saying to the doctor, stop seeing your patient. We are saying to our doctors, see them just better, see them at the right moment. Don't see them when there is nothing to do, just see them when there is something to do. And to do that, to be able to do that, you need to have a monitoring system. it's
Hmm.
it's it's our biggest challenge. It's to really convince the doctor that this type of technology will not replace them, will enhance the capacity and make them even uh, more and more competitive against DTT players.
So obviously that might be a big myth that people have about dental monitoring. So how do you overcome that from your side there? What is there a message you put out? Is there how do you debunk that myth? Because I'm sure that majority of people, as you said, think this is going to be a competition. Think going right to the public. So how do you? Or is there another myth that's out there even higher, or is that the biggest one?
Oh, first, the biggest myth I think is DM is working as a DTC. No, we are not a direct to consumer. We don't sell to patient directly. We sell only through doctors, because it's just a mandate that we have, and we don't have the mandate to do anything else. So I think if people now can take out this myth, it would be good. And the second thing that we prove this is no doctors can use DM without setting their what we call the protocols. The protocols, it's basically the rules that the AI use to monitor the patient. And there is every single doctor has to set his protocols. It's sometimes considered as a bit painful process to set your protocols, but us, we believe that it's mandatory just to answer that the fact that DM is not doing the work, is the doctor doing the work. And this is great value for the patient.
You're supplying the answer to their solution to their problem, and which is a great thing to be able to do. Um, what makes DM different than any of the other platforms or competitors out there?
Oh, with not being bad with them. uh,
Hmm.
First, they really came on the market as a response to COVID, not as creating a market and a product design long term with lots of thinking into it. I think all these competitors that came during the COVID period are just these pop-up stores that came because of a crisis. So I never think that it's a good reaction. So this is just in terms of history. And the second, I think it's technology. It's to monitor patient is a pretty complex thing, and you don't improvise to this. And today, to my knowledge, and I'm seeing all the competition, of course, there is nothing else than just WhatsApp equivalent. It's all the competitors. They are just asking patient to take pictures, and the doctor have to see every single pictures and speak manually to the patient. It's not scalable. It's good if you have 2 3 patients and maybe 10 at max. But if you want something which is robust, which is always providing quality, which is providing the meaningful value that such product needs, you need to have artificial intelligence. You need to have systems, workflow. You need to have customer service. We are 350 people working for the doctor just to help them to get on board and supply the right settings and customer service, etc. You can't be a 2 person or a 10 or even 20 people company to supply this level of service. And I think it's what drive and differentiate DM.
This podcast is brought to you by Ortho Marketing. Ortho Marketing is a full service digital marketing agency exclusively for dentists and orthodontists, providing website design, social media management, search engine optimization, and digital advertising. For more information, visit orthomarketing.com.
Service is so important. Barry, why don't you talk a little about that? What kind of feedback do you have as far as, because you're a user and a client of theirs, what makes them stand out? Not necessarily a direct competitor, but in the industry, what makes DM different than other providers?
Yeah, I think that the key element in just a short answer is the AI, and the protocols and the automation that's built into it. There are some other platforms out there, and as Philippe has mentioned, they're basically uh, they're labor intensive. I don't look at them as maybe saving me any time or making my workflow any easier. That the images have to be viewed manually. There's no, let's say, automated messaging or protocol, so it doesn't really save you any time. And I think that, and in fact, I think they can be more confusing. It's a lot easier to, let's say, have patients fall through the cracks and things like that. And one of the things too that I think is important for doctors to understand about this AI again is, Dean, I think that sometimes I think doctors like think that it's going to be like, the Terminator, like, or like the Matrix. I mean,
Take over everything, right?
yeah, yeah. In popular culture, I mean,
Right.
I think there is a lot of fear about. I mean, and certainly, I mean, people like Stephen Hawking used to talk about it all the time. That maybe there are dangers of AI, but this is not the Terminator. Coming to look for Sarah Connor. This
Right.
is something that is completely defined and customized by me and my staff. So and every doctor is different, so the amount of engagement that you want to have with each individual patient, the amount of engagement that you want to have with your dental monitoring coordinator, because again, your dental monitoring coordinator is sort of is the liaison between the AI and the doctor. So you have a dental monitoring coordinator who's checking the dashboard, who's checking the automated messaging and the images that the patients are sending, and we have a defined set of decision trees of protocols that we have set up. So there are specific things that I want to know. And then there are specific things that I don't need to know. So, for example, Dean, if you did your scan the other day and you got to go, I don't need to see that,
Right.
because I trust the AI sees close to 180 different things. I probably could name only about 10 of them, but if there's anything that might be going on, the AI is going to probably see it before I would have seen it with my naked eye, and on a patient exam. So it's there, but we have humans backing it up, and I think that's the most important thing for doctors to understand, that you're not relinquishing control. I'll give you another example. My dad has a pacemaker, And right then, when he got the pacemaker, they gave him this box, and it's funny, the cardiologist called it his Alexa, and of course, my dad doesn't know what that means. Yeah, it could have been any name, but anyway, he's got this little gadget that sits on his nightstand next to his bed, and that is monitoring the telemetry from the pacemaker. So if my dad has an event, that information is transmitted directly to the cardiologist. And so that makes the cardiologist, I mean, he's basically monitoring his patients in a way that he could never before. I mean, it used to be that, every 3 to 6 months, you go to the cardiologist, they would put some kind of scanner over your chest and download the data. Now he's got that data in real time. So it makes the cardiologist better. And that's what this technology does.
But it has never replaced the cardiologist. It has enhanced the capacity of the cardiologist.
Exactly. Right. And
Exactly.
that's where different than the Terminator. It's
Yeah, you know what? It's not the Terminator.
replacing
It's
people.
more like Rosie the robot from the Jetsons. You know,
Exactly. Very
I,
well. Good. Good.
cooking you dinner.
I have another analogy which really, I think, describe well what we bring as a value to the orthodontist. Is it's exactly the GPS of the car. A GPS in a car, I've never made someone a better driver. You still don't want to drive to be my passenger. I'm still a very very bad driver. But with a GPS, at least I know when there is a traffic jam. I know when there is an accident and I can't go through this road. I'm always it optimizing the route to to the success. And it's exactly what we do. We just give, oh, be careful, there is an accident here. Be
Mhm.
careful, there is a patient is not wearing the liners or the class 2 is not correcting or whatever. This is critical information that then the doctor, through his protocol, can process and fix and interact with the patient to resolve. And I think this is a tremendous value for any doctor.
I great. So let's transition right into that. So I'm going to put you on the spot there and give me three words that best describe dental monitoring. They don't have to go together, or they could be three words that make a little sentence, or three,
Uh,
standalone words. But what three words best describe dental monitoring?
I would start by passionate, because every team player, colleague of DM, and even now doctors, because we have fans, are passionate because of this technology and what change it brings to the industry. Intense, I think, really working for DM, working with DM, knowing us, it's pretty intense because we bring so much on the table that I can say it's intense. Innovation, it drives us. It's what drives us. We always look forward. We never look backward, and we want to drive the innovation. We never do copycat products. We always do new products, and I think it's important.
Great, three great words there. Alrighty, so we're going to continue here. So, what's the best feedback you've received regarding dental monitoring, either positive or negative? A lot of times, negative feedback helps me for my business grow and learn from what we did wrong. I also love positive as well. So, what's the best feedback you've received, one way or the other, from dental monitoring?
There were, I will mention two feedbacks. The first one is a good one. Is I will always remember when Grant Duncan, a doctor of us, called me and say, Philippe, the day you stop, I'm going to retirement because I can't anymore work how I was working before. And this was really it galvanized uh, the team when he told us this. So this was really a great feedback because he could not imagine to see his patient as he was seeing the patient before, the same way, the way with no info, where every time you see a patient, it's a surprise, and he did not want this anymore. The second best advice, it's already mentioned to you. It's come from Terry Selke when he told me one day, Philip, your picture are crap. It's garbage in, garbage out, and it push us to do the sandbox. We push us to invest millions of dollars in innovation again to how can we capture better picture, intro pictures, and so on. And when we develop this piece of device that we combine with AI platform. So these two advice drastically help us to progress.
That's great. It's so important just to have open feedback and be able to accept criticism one way or the other. Big boy, and if I'm doing something wrong for my company, I'd like to hear what we did wrong from your eyes and how we can make it better. And I'm sure you feel the same way in any successful company. If you're not open to hearing feedback, you're not going to get anywhere there, in my eyes. So now let's talk about 2021. What's on the horizon for dental monitoring? Coming up? Well, what can we expect to see on down the pike as far as technologies, platforms, softwares, and opportunities?
It's a great question. We all want, this the dental world like to keep secrecy on what is coming as an innovation. Us, we are very open minded most of the time, and we tell to people transparently what we believe will be the future. So the future of the company is end of Q1 we'll release a completely new doctor platform with lots of new type of assets and AI features and things will help to drive even beyond orthodontist. We'll go to the dental world around dentistry in general and so on. The patient card and the doctor dashboard will also incorporate most of the critics that we have received the past year from our clients to improve the product. Uh, Second, I would say the second big innovation will be the patient experience through the app. We'll come up with a far more ludic, I would say ludic in English, funny experience through the app by incorporating gamifications and a kind of reward system into the app. We have purchased a company in this direction to help DM to have the knowledge and the know-how to do gamification. So we'll bring this type of features into the app very very soon. And the last big thing I think will be continue to grow the company. We are 350 people. We'll continue to recruit a lot of very talented people. And as always say, my partner is already recruit people which are clever than you, more clever than you. So if anyone listen to this podcast and you want to have a good and great position into DM, we are recruiting in all type of jobs from top to bottom.
Great. So we're going to keep our eyes now on the future. So I'm going to ask you to put your crystal ball glasses on and think outside of just the DM, barriers there, but the whole orthodontic industry. Where do you see this going in the next 12 to 24 months, just in your perspective?
To me or to Barry?
To you. Barry and I have spoken about this many times.
uh, in 20 what do I feel about the orthodontic industry? I think the orthodontic industry is it's going to aligner world. This is a fact. Every aligner company is growing at a pace which is phenomenal. Invisalign is growing, Spark is growing, Clear Aligner, Clear Correct, all the labs are growing very fast. So I think there is a tremendous adoption of clear aligners inside the orthodontic industry. The DTC is not going away. So doctors have to respond to it, have to adapt to it. I don't see it as a threat to doctors because I believe that DTT is bringing awareness of orthodontic treatment, so it's even growing the pie. But the doctor have to adapt the experience that they are providing to their patient to stay relevant. So, if the two big trends, nothing really that nobody knows for the next 12 to 24 months. Aligners will continue to grow. Dental monitoring or like will continue to grow tremendously, and DTC will more and more take market shares.
Great. All right. So tell us a little bit about, as an executive, you're a busy person and you're running a company, but how do you keep up to date with newer trends, learning new things? What are your go-tos as far as advice that you could give somebody? Are there any particular podcasts besides this one, obviously,
Mhm.
or websites or books that you read to keep yourself sharp, to learn from others? As you said, it's important to know that you're not that there are other people out there smarter or better, and then how to work with them. So, what advice would you give somebody as far as here's some great tools for that you're using to become a more educated executive, and what you suggest for them?
I think, first of all, it's reading. I think every executive in the dental world should be reading the GCO, should be reading all this scientific article on their field, which they are not. Most of them are not, and they should be reading them because it's what really drives the industry. It's a science, it's a knowledge, etc. The second thing that I do a lot, it's I'm going a lot to doctor practices. I don't think that there is a month where I'm not passing 1 or 2 days in a doctor practice, even if I have a very busy schedule. Why? Because you need to see what is happening, and you don't need to see what they are doing with your product. Otherwise, you always stick to your product. You need to see what is happening with other product, with other techniques, etc. So I think this is critical. Reading and going to your client. This, of course, listening to your podcast is what I
There you
consider
go.
also as reading.
Gr- Great. So I wanted to ask you one last question, because I wanted to thank you so much for your time here, Philippe. This has been really educational. I'm excited to see what's coming down the pike with dental monitoring, and to use it and to help promote it for many of my clients. So, it's a quick question for you. I asked this to several people. So, the world is getting hit by an asteroid tonight.
Mhm,
Okay,
mhm.
what's the last meal Philippe Salah is eating? Okay, that's it. So, appetizer, main course, dessert. What's on your plate? Because that's it.
I'm French, huh?
You sure are. So you
I'm
know
French.
food. So
I'm
why don't you
French.
tell
So, so,
us?
so it's like every day is my last meal. French
Good.
guy. So I would start with what would be my entrance, my starter. Good question. I did not think about it. I will take probably a plate of cheese, which
Okay.
normally we take at the end, but me, I like to start with it. So I will take a plate of cheese, of French, smelly, disgusting for most of the people, cheese, with true bread, with a true good, straight out from the bakery baguette, then
Nice. Okay.
with a tremendous wine. This is super cliche, but this is really what French do.
Sure.
The meal itself will probably take something that my grandmother is doing very well. It's bœuf bourguignon. I don't know how to translate this. It's a very
Beef
traditional
bourguignon.
way
Okay.
of
Yep.
beef
I know
bourguignon.
it.
Is a wine sauce beef cooked for hours with some potatoes and so on into it. It's
Nice.
pretty heavy.
Okay.
It's a pretty heavy meal, and you don't care about your body at that stage because you're dying in 2 hours, huh? Okay, so you
Right.
you
Exactly. Right. Right.
which I will continue with probably a Chateau Margaux because I will take one of the
Nice.
best wine
Okay.
available, a Chateau Margaux available with my beef bourguignon.
Okay.
I will continue with a white fish because you need to prepare for the second plate of cheese and the dessert. So a quick fish that brings some space into your stomach.
Okay.
A smelly cheese, one smelly cheese
Stinky
to
cheese. Good. Okay. Love
goalkeeper.
it.
And then a dessert, I will just take fruits. I'm not a dessert guy, but I
Oh,
love.
really? Okay. So that's it. No, no, nothing sweet. No chocolate. Nothing. No ganache. No, just the
I'm
fruit. That's
I'm
it, huh? Okay.
If you have an ice cream with cheese, I will take it.
Okay. Okay. Interesting. Ice cheese ice cream. All right. That might be next on the DM menu there. Invent cheese ice cream.
I'm not a sugar guy.
Hey, excellent. Good. Okie dokie. So, if and in closing, if you had to just,
What would be your
you have
favorite meal? Tell me, what would I will reverse the question? Maybe people don't
interesting.
do this, but it would be interesting to me to know what would be your meal.
Okay. Um, for me, I'm a New Yorker, so my first app thing is a slice of pizza.
Okay,
Okay, with the appetizer. Then I'm having a nice big porterhouse steak.
okay,
Okay, with some mashed potatoes and some string beans, and I'm ending it with, of course, my favorite candy now, Reese's peanut butter cup.
yeah. you know, I, I should stop eating your stuff.
It- Hopefully, we got everybody in the office there bouncing off the walls with all the sugar, but it's worth it to watch them just go off and then crash. So that's me. It's simple and easy. It's a slice of real good pizza, a great steak, and of course, end it with the peanut butter cups for me. And how
Nice.
about Dr. Glazer?
You, Barry? Barry? Oh, I think we lost Barry.
Stuff. So now I can get rid. I don't have to worry about that anymore. I think I might want to start with a nice soup. I don't know,
Mm,
maybe
You're too correct, Barry.
uh,
like a
It's a
nice,
last
like
dinner.
a nice. What's that?
It's a last dinner, and you start with a soup.
Oh, yeah. It's better than a slice of pizza, for goodness sake. Yeah, no, a nice. I don't know, like a nice, like a hearty soup. Like oh, I don't know, like a squash soup or something like that. Then for dinner, Dean, I think I'm gonna split that porterhouse. We'll get that porterhouse for two at
okay. Well,
the one that we have
Benjamin,
Benjamin Steakhouse.
for Luger. Okay.
The one that's like cooked in butter. Like
Yep,
it's not
of
enough that they
course.
have to like put butter over the top, like
Right.
a Ruth's Chris. I think that's good. I have to get side, some asparagus, get some potato gratin maybe on the side. I think that might be a nice second course. Um, and then for dessert, I think I'd probably have to go for some kind of like I think it's got to have chocolate in it, like a chocolate lava cake or something like that, with some maybe vanilla ice cream. I guess.
Nice.
You know
Nice.
what, guys? If the TSA let me go into US, let me invite you in January about this dinner. It make me
Okay. Done.
start.
All right, you're on.
Love it.
Without the asteroid, if I think hold the asteroid, it would be.
Right. It's exactly. All right. So in closing, Philippe, I'm going to give you a little pedestal here. So you got 30 seconds. Okay. Just what's your final message to the orthodontic dental community, as far as what you want to tell them? You got it right now. It's all in your hands. Whatever you want to say, go ahead.
So if I've got 30 seconds, I will say, believe in the future. It's not a bad thing to adopt innovation. Dental monitoring is really part of what is coming into the orthodontic industry. It become very important to take into account the fact that patients are seeing the world differently now, and we help you to give them the answer. We have a tremendous team in the US, in Europe, in Asia that can support you, because I believe that people are listening from all over the globe. And
Mhm.
so we've got really tremendous team on every single state of US who can support you, help you to change your practice and adopt this type of technology. Thank you so much for inviting me to this show. I think I'm always looking for the new one. And who is your next your next guest?
Oh, that's a secret. You'll have to stay tuned. We can't give
Yeah.
it out. But it'll be pretty exciting. That's for sure.
So just visit
So,
dental-monitoring.com. Will drive you to your local people and representative. And if you want to contact me, Philippe, Philippe at dental-monitoring.com. Even as a CEO, I don't care. Everybody can join me, and we'll always find time to talk to you.
Excellent. Thank you so much, Philippe. I really appreciate it. This is very interesting. Look forward to doing this again with you and to keep in touch. And and of course, we're going to take you up on that meal. So look forward to
I will. I will.
to it there. So again, thanks so much. Have a happy holidays, a happy New Year. Be safe, and look forward to a great 2021. Everybody in podcast land, thank you so much for listening. Everybody out there, again, as I said, be safe, be happy, keep smiling. Bye bye.
Thank you very much. Bye bye.